This project is being funded by HEFCI and the College of Policing, and the aim of the project was to build partnership between the police and the university around potentially a whole range of issues, and the issue we focused on was mental health. And the fundamental issue around policing and mental health is that what we've seen over the last few years, particularly as a consequence of austerity, has been significant cuts in mental health services and mental health provision. And of course, at the same time, is increasing demand for mental health services. And the problem is, actually, if you think about it, if mental health issues are not resolved, there is a point at which they have to be picked up. And frequently, the point that they're picked up is by the police. Because if somebody with mental health issues receives no help, there's a very high likelihood that they'll become involved in issues of crime or drug taking or alcoholism. And so what's happened over the last few years is that the demand on police time to deal with mental health issues has increased very significantly. But one of the problems, which in a sense is an obvious problem, is that most police officers have not been trained, or if they have had any training, it's been very minimal, in terms of dealing with issues of mental health. And one of the significant problems is that either police officers can spend much too much time dealing with mental health issues because they tend to be very risk averse and they feel that they can often can't leave people. So a lot of policing time is spent dealing with mental health issues and therefore can't be dealt with even other issues. Or alternatively, there are occasions when police make mental health situations worse because they don't have the training for dealing with people in crisis situations. So the aim of this project, in fact, was manifold, but because of the time, I'm just going to speak briefly about a couple of things. So on one side, one of the things that we were looking at was the issue of how, in a sense, is where I come in as a political scientist, is the way in which different agencies work together in terms of the provision of mental health services. And the other area that I wasn't really involved in, but was a big part of the project, was ways in which we could improve the training of police officers in terms of dealing with mental health issues. So one part of the project is, as I said, looking at understanding partnerships between the different agencies. And of course, one of the things that's very interesting is actually, although Britain is often seen as a very highly centralised policy system, actually when it comes to the delivery of policy, it's often fragmented. And even in an area like North Yorkshire, you can actually see services provided in different ways across different parts of the county. And so one of the problems that we've sort of been looking at is actually how can you try to improve cooperation between different agencies through the delivery of mental health services. Because ultimately one of the problems is issues are being dealt with by the police when they should be dealt with elsewhere along the train, whether it's in relation to, it could be in relation to housing, or it could be in relation to healthcare. But actually one of the problems with austerity is that there's a very strong incentive for organisations to pass the buck, because actually what they're doing is saving their budget and passing the costs on to other organisations. And one of the problems that people have recognised for a long time in the UK is that if you want to provide more effective delivery of services, you need a way of sharing budgets. And in many ways, we haven't got there yet. But part of the project, and I think really one of the things that came out of the project is actually when budgets are shared, because actually there have been quite a few cases in North Yorkshire where health service providers have given funding to policing for particular services. But actually when that does occur, it occurs on a very ad hoc basis, and it depends on particular relationships. So one of the things that we've been looking at is whether there are ways which you can institutionalise those partnerships in order to see, in a sense, the whole process of mental health service delivery as one issue, and start to think about how you can better work across agency to provide more seamless provision of services. And I think the key thing about that is that it ensures that the appropriate agencies deal with the appropriate issues. Because clearly, I think one of the issues is that if someone has a mental health issue, they're much better being seen by a mental health professional than a police officer. But the second part is that actually there's no getting away from the fact that police officers will deal with people with mental health issues, partly because people with mental health issues commit crimes like anybody else, and partly because often when there are issues involving mental health crises, people often call the police, and sometimes other services are slow at responding, or the services aren't there if it's outside working hours, things like that. So there's no doubt that whatever happens, the police officers are involved in training. And so one of the key aspects of the project was actually to get together and test out a much more effective package of training for police officers, so that they become better, at least for instance, at recording incidents of mental health events. Because of course, a key issue is that if you don't have training, you don't even know the difference between someone having a mental health issue or some other issue. And if that's not properly recorded, it comes back into the system. Improving the way that police officers respond to issues so that they do things that don't escalate events, and also knowing who to refer particular people to if there are problems. And I think one of the key things is just that we need to ensure that the training is delivered by NHF professionals and not by the police, that there is refresher training, that there's better access to records, and also that in terms of this process, you need to train the other professionals as well as the police officers. Thank you.